Hillary Acer, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Today, we continue our NextGen Journeys series featuring conversations with learners and early career clinicians around the globe to get their fresh perspectives on education, medicine, and the future of healthcare. For that, we are happy to welcome Dr. Catharina Giudice to the podcast to dive into a growing area of interest for healthcare providers, the impact of climate change on health and healthcare delivery. Dr. Giudice is deeply engaged in that issue as a research fellow at the Climate and Human Health Fellowship through Harvard University's Center for the Environment and the Center for Climate Health and the Global Environment at the Harvard T.H. Chan School of Public Health. Her academic work focuses on healthcare sector climate preparedness and adaptation, with a focus on serving at-risk communities. She's also an emergency physician in Boston and happens to be one of my longest friends from UC Berkeley in our undergraduate days. Thank you so much for joining us today, Dr. Giudice. It's a pleasure to have you here.
Thank you so much for having me, Hillary. Hope it's okay to say we've been friends for a while, and I'm very excited to come to your workplace.
Catharina and I met our first year at UC Berkeley as fresh new undergrads in California, pre-meds, and we ended up staying friends for several years, still are friends today. So it's really fun to be reconnected and also just to have followed your career journey to where you are today. And I'm really excited to dig into all that you've been up to, especially in the climate medicine space.
Thank you. I'm, again, excited to be here. Let's do this.
So while I have followed your journey for the last several years, our audience is just getting to know you. Can you share a little bit about your journey and what first got you interested in medicine and becoming a doctor?
Yeah, hopefully this is not a cliche answer because I think that a lot of people that go into medicine might feel very similarly. I liked science. I was fascinated by anatomy. I was fascinated by physiology. And maybe a little bit idealistic, I also wanted to help people. I wanted to have an impact. So I think that was probably the early triggers of my interest in medicine.
And as you continued throughout your medical career, you ended up going into emergency medicine, which I always find to be one of the most intense fields. So what drew you to emergency medicine?
Emergency medicine, I think, spoke to me for several reasons. I remember being in medical school, going through my core clerkships, all of my main rotations, and really enjoyed basically everything. I liked surgery, I liked pediatrics, I liked OBGYN, I liked family medicine, and emergency medicine was attracting because it was a field where I could still do a little bit of everything. I really liked that it was a dynamic field. You never knew what you were going to get through the door. No day was similar to the day before. And I really loved the idea of being a frontline provider and being there for patients in their moments of greatest need. And the other thing that appealed a lot to me is the idea that the emergency department is the safety net of our healthcare system. And it cares for very vulnerable populations that typically you might not have the best access to care all of the time. So that was also something that was important to me. And I like the people. I think the community also was very embracing. So a few reasons. And I think it was the right decision at the end of the day.
Ever since I've known you, Catharina, I have always been impressed with your commitment to really helping vulnerable populations and making sure that that's kind of front and center. I think it ties into the career direction that you've moved in as well with more of this climate medicine focus. And so I understand that you have experience providing healthcare during some really intense disasters, including things like heat waves and wildfires in California. And that was one of the things that actually motivated your interest in climate and health. Can you share more about that?
That's right, Hillary. And you might remember I was always very interested and concerned about climate change, probably even before medical school, always aware of the indisputable science behind burning of fossil fuels driving climate change. And even before I talk about my experience in residency, I would say that in medical school was very formative for me in my understanding of how climate change was impacting health. I was very lucky to meet Dr. Jay Lemery when I was in medical school, who was one of the pioneers in the discussion of climate change in medicine. And I think he was the first person that really opened my eyes on how climate change was already impacting health. And you're right. I think residency was where I found my agency in this discussion. I trained at a safety net hospital where I think we were already particularly impacted by COVID, very strained from a health resource standpoint. And in the middle of the pandemic, we were also, on top of that, seeing some of the worst heat waves in Southern California history. We were seeing some of the worst wildfires. And I remember taking care of patients that came in with heat stroke, with a variety of heat illnesses, responding to codes in the hospital of decompensating wildfire victims. So seeing how climate change was exacerbating a health system that was already very strained really opened my eyes and got me, perhaps inspired might not be the right word, but got me thinking of what I could do to make a difference in this discussion. So that, I think that was really what motivated me to want to pursue this fellowship and learn a little bit more about the intersection of climate change and health and figure out how it could have a more meaningful role.
Thanks for sharing that background. It must have been quite an experience to go through COVID as a fairly new clinician, a resident, and then on top of that, to be facing all of these really extreme weather events and figuring out how best to treat patients and how to plan for the future. For those who are maybe newer to this space, Catharina, or newer to climate and climate medicine, can you define that field a little bit and explain kind of what the goals are, what we should be thinking about for the rest of this discussion?
Absolutely. The way that I would frame it, Hillary, is the intersection of climate change and human health really thinks about how climate change is changing weather patterns that are ultimately impacting health and ultimately impacting people's abilities to live a long and healthy life. The other way that I like to frame it is that I believe the medical field has a dual responsibility in this conversation. The medical field obviously produces a lot of greenhouse gases. In the U.S., it produces 10% of national emissions, which is a non-insignificant number. And we're also seeing the impacts of climate change on the health of our patients, and it's impacting our ability to deliver high-quality care. So I think the healthcare system is in this interesting intersection when it comes to its roles and responsibilities as it pertains to climate change.
I actually did not know that the healthcare system was responsible for that many greenhouse gas emissions. That is quite high. And so I appreciate you pointing that out. It sounds like there's a lot more work to be done in that space. And it also sounds like that's what led you to pursue this research fellowship. So tell us a little bit more about what you're researching at the Climate and Human Health Fellowship at Harvard.
I would probably start by saying that there's a lot that physicians can do in the intersection of climate change and health. And fellowship for me was an opportunity to really explore where I fit into this discussion, take a little bit of space from pure clinical practice to develop a deeper expertise of what's driving climate change, how it's impacting health and healthcare delivery. And because there's so many different roles that you can take in this discussion, I think my fellowship has given me a chance to really explore what these different directions can look like. So as a fellow, I participate in education of current and rising healthcare providers, sharing, again, some of the health impacts of climate change and some of the more action-oriented things that we can do as a field. I have a chance to participate in media interviews, again, sharing some of the research and my experience as a clinician caring for patients impacted by climate change. The fellowship gives me an opportunity to do research to understand the impacts of climate change on health and answer some operational related questions. And the last thing that I think has been very valuable for me is the opportunity to share my experience caring for patients in the setting of climate change and policy platforms, both nationally and internationally. So it's been a broad experience, but I think important to help me understand exactly how I can fit into this very complex, multidisciplinary field.
Yeah, it sounds like it is quite broad and there are so many different ways to have an impact, but getting that foundation first is really important so you can understand how best you can use your skill sets and your interests to make a change. What does current research tell us about how healthcare delivery is actually impacted by climate change?
Hillary, there's a lot of research on this topic. I think simply put, climate change is a risk exacerbator. Climate change is worsening health outcomes, especially for people that already have medical conditions, people that are already vulnerable from a health standpoint. And the research is, as you can imagine, health is an incredibly broad field, especially when you're thinking about community health and public health. As I had shared with you earlier, climate change is making extreme weather events worse. And that really depends on, it's very geographically specific. So if you live in one part of the country, you might be seeing some weather events that might not be as common in other parts. For example, when I was living in Los Angeles, we were particularly impacted by extreme heat, wildfires, and then more recently, flooding and storm surges became an issue. Now I'm in the Northeast, where I'm currently working, and obviously heat waves are still a big deal, but I think we deal more with flooding and the threats of hurricanes as they're moving to higher latitudes. So it's very geographically specific. The research is very geographically specific as well. But to give you kind of a general idea, I think heat is something that we attribute as one of the main environmental hazards that is getting worse because of climate change. So heat waves are becoming more frequent, they're becoming more severe, they're affecting communities that historically may not have been affected by heat waves, and the heat wave seasonality is obviously becoming longer. Heat has been linked to worse cardiovascular outcomes, worsening of respiratory diseases. Heat has been also associated with exacerbation of mental health illnesses, renal injury, electrolyte imbalances, increased mortality, you name it. From a health system standpoint, right, that we're talking about, we were just talking about some of the individual health impacts, but from a health system standpoint, it's also having pretty substantial impacts that have been supported by extensive research. So we know that heat is increasing hospital emergency department volumes. We know that heat puts a big strain on the electrical grid. So in places that are not prepared for surges in electricity demand, this can cause outages, and it can impact hospitals and force them to rely on backup energy if they have it. So there's extensive research, and that can apply also to all of the other weather events that are being increased or exacerbated by climate change, like wildfires, extreme weather events, storm surges. I can talk about it for hours and hours and hours, but just to give you a general sense, there's very extensive research out there that's in very, very wide facets of health and healthcare delivery.
Wow. I mean, when I hear you say that, Catharina, I hear just alarm bells. You know, I think that these alarm bells should be going off and there should be a more robust response to these things. And I'm just curious if you're seeing kind of an appropriate response to these issues so far.
That's a great question, Hillary. Obviously, climate change is not a new issue to health and public health. But you're right. I think medicine in general has been far behind where it should be in terms of talking about climate change and its impact on the field and having a more proactive role in both mitigating, so decreasing greenhouse gas emissions, and adapting to the already ongoing and likely worsening impacts of climate change. I think the medical field is obviously very good at interpreting evidence, so there's not really a doubt of climate change being a big concern. But I think more people are starting to talk about specifically the impacts of climate change to health and healthcare delivery, which I think has been gaining really great momentum in the last several years. I think there's been a lot of discussion too and recognition of the healthcare system being a big contributor to the issue, so being a big emitter of greenhouse gases. And there's been a lot of momentum on individual hospitals or healthcare systems starting to take action. So I think we're going in the right direction. There's been many medical societies that have released policy statements on their specialty's role in the climate change discussion. Many hospitals and healthcare systems have signed on to the Biden's administration's healthcare pledge that, again, acknowledges the importance of mitigation and adaptation and having a proactive approach. Hospitals are starting to hire sustainability medical directors and think about how they can decrease their environmental impact. A lot of public health departments are training heat officers and creating regional adaptation plans. So I think the momentum is going in the right direction.
I'm glad to hear that. It sounds like while there is still more work to be done, obviously, to address these changes, there's at least some good momentum, as you've mentioned. And just getting back to what you said earlier, and just in knowing you for the last 15 years, you have this special interest in how climate change specifically impacts these at-risk communities. And we know from public health just how equity is such an important part of the discussion. And that's one of the things that's really at risk here with these exacerbating climate issues. So how do you see these impacting at-risk communities? And can you tell us a little bit more about that?
Thank you for bringing that up, Hillary. I think that's such an important point to make. At the end of the day, I see climate change as a social justice issue. Yes, everybody's being impacted, but not everybody's being impacted equally. The people that have contributed least to the issue, both nationally and internationally, are typically the ones that are being most impacted, and also are the communities that have the least resources to adapt. In the U.S., for example, the communities that are being most impacted by a lot of the climate hazards are communities that have already faced really high burdens because of systemic racism, have disproportionately suffer from other social determinants of health, and they're the ones that are being impacted the most. People that live in inner cities with poor tree coverage, that are facing urban heat islands, that typically live in crowded environments with little or no air conditioning, are the ones that are having the worst health outcomes during heat waves. And again, I think similarly, people that have already a lot of health vulnerabilities are the ones that are being impacted by all different climate hazards, from wildfires, flooding, hurricanes, etc. We see many of these examples of the unequal impact of climate change, both nationally and internationally. So this is not just a global justice issue, it's also social justice within the United States.
That's really helpful context. And I know that you have some more direct experience with this too from your undergrad days. You went back, I remember, to the Amazon, and you actually did a summer of service there. Can you share a little bit about that specific experience?
Wow, you're really having me
go off
dig
script
back into my memory. Yeah, I had the privilege of working with an awesome organization that works in the Amazon rainforest region that provides healthcare services to riverside communities. So at the time, they had a medical boat that would sail down one of the tributaries of the Amazon, and they would distribute public health education and primary care interventions to communities that typically don't have very easy access to healthcare. So medication refill, screening for blood pressure and high glucose. So it's a phenomenal organization that's still very impactful in the region. But tying it back to our discussion on climate change, Hillary, I had the opportunity to reach out to them. And in the Amazonic region, there's been a lot of issues with droughts and wildfires. And the same communities that I had the privilege of meeting and serving when I was there have been really impacted by some of these climate change impacts. The droughts have decreased the river volumes, making transportation in and out of these communities very difficult because they depend on the riverways to be able to go in and out of the communities. And the wildfires have worsened the air quality in the region, so much so that it's been very difficult to access the communities via helicopters or other airways to be able to deliver supplies. So it's been a very difficult situation in the field in that region, and it's been putting a lot of strain on food security and water security as well. So it's, again, another example of how every community is being impacted in very different ways, but also very meaningful ways.
Yeah, thanks for sharing that. I do remember when we were chatting about that in preparation for the podcast, you had shared that example. And I think it is just such a graphic example of how communities around the globe are being impacted by climate change and this crisis. Zooming back out, or maybe even jumping forward to where you are now at the Harvard T.H. Chan School of Public Health, my understanding is that they just launched a new concentration in climate change and planetary health. And that's part of actually what your fellowship is related to. So can you tell us a little bit more about that program specifically and what you're hoping students will gain from that study track or other students will gain from that study track?
Absolutely. So the track that was released recently, which I was so happy to see, is for students that are pursuing their master's in public health. So it's tangentially related to my fellowship, but I wasn't directly involved in the development. But Dr. Basu, who is an incredible educator and a just very, very thoughtful physician, was one of the people that took charge of this initiative. And I think the curriculum reflects his thoughtfulness. It's intended for students to get a comprehensive understanding of both problems related to climate change and its impacts on health, but also solution-oriented curriculum to prepare leaders in public health that are going to have a meaningful impact as they go on to a variety of leadership roles. There's been incredible interest in the curriculum. It's brand new. It just released, I think, this year. And there's been a lot of interest throughout the School of Public Health. And I think it speaks to the growing societal concern of climate change as a huge health issue. And I'm excited to see where the curriculum goes, and I'm excited to see it gain traction in the next couple of years as it continues to grow and establish itself within the school.
We'll certainly be following that, and I'm glad to hear that there's such an excitement and an energy around that specific concentration. It also sounds like it's very, as you mentioned, solutions-oriented and practical, where those who are going through this program will really be prepared to hopefully help to tackle this issue more directly. I know we already touched on this quite a bit, but do you have a sense of how well understood and accepted this new specialty area is by the healthcare provider community?
Climate change is not an issue that is debated within the medical field. I think the evidence is very clear. I think that in the last many years, we've been moving in the right direction in terms of recognizing that climate change actually has a huge impact on health and healthcare delivery. So I think that discussion has become a lot more prominent within different medical circles. Like I shared with you earlier, a lot of medical societies have released policy statements of how their specialty can participate in the discussion in a more meaningful ways. Hospitals and healthcare systems are taking action to reduce their greenhouse gas emissions, and a lot of hospitals and public health departments are also starting to think about adaptation plans. So what can we do proactively to better prepare ourselves for the already ongoing impacts of climate change? So I think I might be biased. I wish that we were doing more, doing it faster, but I think that the discussion has gained quite a bit of momentum in the last couple of years, which I'm very pleased about. And I hope that we continue to grow this discussion as a field.
Certainly. And if those listening are interested in getting more involved, it sounds like a good place to direct them would actually be these medical societies for their specialties, to maybe reach out to them and see what their statements are and see how they can get more involved, or perhaps sustainability divisions or departments within their hospital systems. Are there other resources that you would recommend those who are interested in learning more about pursue, aside from maybe going to the T.H. Chan School of Public Health and actually doing this Master's of Public Health or diving deep into this area of study?
Yeah, that's a great question, Hillary. There's a lot out there, and it just really depends on what the intention is behind wanting to get more engaged. There's a lot of curriculum that have been developed over the last couple years. Some of them, I think most of them are pretty broad and are very ideal for any field of medicine, just kind of getting a general sense of how climate change is impacting health. There might be some curricula that are a little bit more specific by specialty. I know that in emergency medicine, we do have a few educational platforms that have released content related to climate change. There's a lot of organizations out there that are doing incredible work in the intersection of climate change and health. For example, Practice Green Health is an organization that helps hospitals, different sustainability interventions and decrease their carbon footprint. And their parent organization, Healthcare Without Harm, puts a conference that's called Clean Med. So those are great organizations to start with if people want to get a little bit more engaged and learn more on the topic. But also reaching out to local committees within their hospitals would be a great way for those that want to have a little bit more active role and see how they can have an impact within their own organizations. Like I mentioned earlier, a lot of hospitals are hiring chief sustainability directors or other sustainability experts to help decrease carbon footprint. And that could be a great place to start to learn how we can be a little bit more proactive in the issue.
We definitely encourage folks to look into these resources, and we'll link to some of those organizations that you mentioned, Practice Green Health and the Clean Med Conference, in our show notes in case those listening want to dig in. And just starting to close out this conversation, Catharina, we're a teaching company, as we mentioned, and one of the main missions of Osmosis is to fill knowledge gaps, both for clinicians and caregivers, as well as patients. Is there a topic that you think Osmosis should make a video or series about to fill a gap that's of particular concern or interest to you?
I think the more content we can spread on how climate change is impacting health, the better. I think that something that's very important, as somebody that has been having this discussion with my colleagues for many years, is that there seems to be a gap on what we can do about it. And obviously, it's a new discussion in medicine, and a lot of these initiatives are quite new. The content on what we should be doing about it being a little bit more solution-oriented, how we should change our clinical practice, how should we be counseling patients. I think that material that helps people think about the next steps is really critically important.
Well, we'll pass that along to our content team in hopes of continuing to create more important educational content around that. And just one final question for you, Catharina. You've been an inspiration to me as I followed your medical journey over the last several years. So I've watched you kind of dig into these really critical areas like climate medicine and make change. I know there are so many healthcare professionals out there and students in our audience that are trying to find the right path for them. What advice do you have to them about meeting some of these challenges and even just approaching their career in healthcare?
Well, first of all, Hillary, thank you for being so kind with your words. I think my general advice, Hillary, is find something that sparks your fire. A career in medicine obviously has its own challenges. It's not always an easy path forward. So it's really important to find something that inspires you and that makes you want to continue to learn and grow, something that makes you wake up every day and really triggers you to fight for a cause. I think that's been very important for me to grow into a career that I feel is sustainable throughout the years. And in terms of those that want to get more involved in the climate discussion specifically, we already talked a little bit about some of the resources out there, but I would say that you don't have to dedicate your entire career like I am. There's so many small things that you can do as an individual, as a clinician, to make a difference in the climate change intersection. Like we talked about, thinking about how we can change our hospital protocols and practices to decrease environmental impacts, learning about the issue, talking about the issue, not just with your peers, but also with your patients and educating them and giving them tools of how they can protect their health. There's so many little things that we can do every single day that doesn't interfere too much with the flow of patient care. So, and for those that do want to get more involved in the climate conversation, have a more active role, we need more people. There's a lot of incredible fellowships out there that are starting to train early clinicians or mid-career clinicians on how to incorporate climate change in their careers. So we would love to have you join the team.
It sounds like the opportunities are certainly endless for getting involved. And as you mentioned, we could use a lot more minds solving this problem and hearts kind of bringing that passion Just the one thing I want to end on, as you said, is just finding something that sparks you. And what that reminds me of is this theme of sustainability. So not just sustainability for our world or our healthcare system, but also for you as an individual. You know, this work is challenging. It requires a lot of energy. There's going to be a lot of adversity along the way. And so finding something that is sustainable for you, I think, is just such an important takeaway. So thank you for sharing all of your advice. Thank you for educating us on this really important topic. And hopefully this isn't the only conversation we get to have with you. I'm sure there's many more details that we could go into. And so hopefully we can continue the conversation either on the podcast or in other formats in the near future.
Absolutely. Thank you so much for having me, Hillary. It's been a pleasure.
Thank you so much for being with us today, Dr. Giudice. With that, I'm Hillary Acer. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.